Good morning and welcome to all of you. In partnership with Denmark's Innovation Center in Israel, the Danish Chamber of Commerce, and the Danish Trade Council here in Istanbul, it's my great pleasure to welcome you to today's event. Today, we host the first of our regional webinars on digital healthcare. Digital and innovative healthcare are ways forward to increase global health. During COVID-19, it has become painfully obvious how fragile our healthcare systems are, with closed borders and broken supply chains and millions of people confined to their homes. Add to this increasing urbanization, leaving rural areas isolated, deserted, with limited areas to professional healthcare. The Sustainable Development Goals luckily also put focus on our health and has led to increased efforts globally around the world. And Denmark has for decades been leading within innovative healthcare technologies, preventive medical applications, integrated and coherent care, telehealth and personalized treatments, and sustainable hospitals. Actually, the Danish hospitals have promised that by 2030, there will be 75% CO2 neutral. We have succeeded in creating an innovative ecosystem where digital health, medical technologies, health informatics, and smart patient journal solutions are developed in cooperation with the EU and other leading global stakeholders. Both Turkey and Israel has local success stories in building public-private partnerships for digital transformation, very much in line with my favorite Sustainable Development Goal number 17, Partnerships for the Goals. I truly believe that international cooperation is the way forward and very much possible also in our two countries, in spite of any political differences. Therefore, I would like to invite all interested stakeholders from Denmark, from Turkey, from Israel, to reach out to us at the Trade Council here in Istanbul, the Innovation Center in Israel, to explore new and innovative partnerships to the benefit of global health. Thank you very much, and I will now give the word to Christian von Storm Jonassen from the Danish Trade Association. Thank you.
Yes, good morning everyone, and thank you for having me here. I'm very pleased to see that so many people are joining a panel which in my mind is crucial for the future of health, both in our respective countries and globally. What we've seen at the Danish Chamber of Commerce is that the recent COVID-19 crisis has accelerated innovation in our companies, and we have been very pleased to see many of our member companies, both within the healthcare sector, but also companies of all sizes, refitting their production in order to make the necessary protection equipment for healthcare workers, and also, for instance, beer companies who suddenly turn their production into creating alcohol gel to desanitize your hands. But another lesson that I think that this current crisis has shown us is that healthcare innovation is not only something that we need to focus on for the coming years, but is something that we need as a long-term strategic goal. And I'm very happy that Annette mentioned the 17th SDG, because one of our core focuses in the Danish Chamber of Commerce is that public-private partnerships is the way to go, the best way to get the full benefit of the resources that are found in the public sector and the innovative force that often resides in private companies and startups. So with that in mind, I would like to give on the baton to Yael Ophir, who will guide us through today. So thank you very much.
Hi, everyone. Hope you can hear me. So I'm very excited to moderate this session. My name is Yael Ophir. I'm the Executive Director of Health IL, which I guess I'll present a little bit later on before the panel. But in brief, we are a national program to promote digital transformation in healthcare in Israel. So we dive in right to the interesting short lecture that we have. So the first one, I'm very happy to present Anne Fleischer from Leo Innovation Lab, talking about innovating to improve life for people living with a skin condition. So Anne, the floor is yours.
Thank you very much, Yael, and thanks for inviting me. I'm very happy to be able to share our mission for creating better lives for people with skin conditions. So let me put up my presentation. So do you see my presentation all?
Yes.
Yes. So, so innovating to improve the lives of people living with a skin condition. The reason why we were established in 2015 was that Leo Pharma, which is the oldest pharmaceutical company in Denmark, had many successful years in providing medication for people with skin condition, but also acknowledged that we could do much more than that. And being a foundation-owned company, we could really begin to think how we could make lives even better. So in 2015, we started to work towards what we call integrated care, which is a multidisciplinary approach to really make a better life for people living with a chronic skin condition. We took the patient really into the center of everything we did. Everything from looking into what happens to your skin when you eat and drink certain things. How is your mental health impacted by having a chronic skin condition? How is your family supporting you? What's your educational background, and how can you see relationships between that and how you live your life? How does it impact to have a healthy, sporty life? And last but not least, how is the relationship with your doctor? So what we here state as HCPs, healthcare professionals. So, and being the oldest pharma company in Denmark, established in 1908, we have had a very, very long relationship with doctors. So that was really where we focused in very early to see how can we make that relationship even better. That was why we looked into, so what happens today when you see something new on your skin until you get the right treatment and live a good life with your skin disease, what happens to you? And this is what we have been illustrated here in the patient journey. And I will walk you through it very, very quickly. So you see something on your skin, a rash or a flare-up, and then what most of us does is that we go to Google and we search for answers. And here actually 34% of the times we are actually finding the right diagnosis already at the first step. But what happens then is that you get directed to all these tips and tricks. You ask your friends and family, you ask the pharmacy, what can I do? And not always those recommendations are the best thing for you. Initially, you would go and see your general practitioner, your doctor. And here, unfortunately, the waiting times, many places in the world are very long. And we also know that some don't even have access to a GP. But if you have one and you get a consultation time, you would often wait 2 to 8 weeks. This is really a pain point for patients to have this uncertainty for so long. It's often not an acute disease, so that is why you don't get a schedule just the day after. When you then go see your GP, then there is the case that actually half of the times the GP is not diagnosing you correctly. And there are many good reasons for that. The GPs have many diseases to learn and to look for, and having 2,000 skin diseases in a med school where they have dermatology for 2 weeks, then it's clear that it's difficult to learn all those skin diseases. So what happens is that you would get to try many different treatments. Often you would treat symptoms. So if it's red or scaly, you get a cream for that. And that way the doctor can find out what you actually have. Eventually you would be referred to a dermatologist. That can take up to 6 months. In the city center of London, the waiting times is actually 1 year if you don't pay out of pocket currently. So you would see here that, again, you live in a time with a lot of uncertainty. You don't get treated well, and that can, of course, impact your life in many different ways. When you are lucky to get an appointment at the dermatologist's office, we are quite certain that you get the right diagnosis and therefore also get a prescription to the right treatment. But then we get a new pain point coming up because we would need to consider, should I pick it up and can I afford it? And actually 50% of all prescriptions made, the medications are not picked up. So that is actually a great waste of both the doctor's time and the whole system. Eventually, when you come home with your medication, you will by then need to remember, so what did the doctor say? Should I treat myself for two times a day for 3 weeks, or was it 3 times a day for 2 weeks? You know, all those uncertainties again, that result in poor adherence, and you get in doubt whether this is really the right thing to do. And I'm quite sure that most of us have tried to get this pack of penicillin or something else where we have to treat for 10 days, and after 7 we feel right, we feel good, and we stop, and then it comes again. So this part about adherence is really something that is really key to have a healthy skin. So as you see, there are many pain points, but also many potentials in the current patient journey. What we all want as patients is really the doctor to be competent, to really care about us, to know us very well, and then we want something instantly. We don't want to wait for half a year. And optimally, of course, we want a prevention to my problem. We don't want it to happen again, and ultimately, of course, a cure. So that is why we believe that the patient journeys in the future will look very different than it does today. We believe that you still would go to search for what it could be, but then you could be directed towards an app where you could snap a picture and get a diagnosis right away. Approximately 60% of all skin issues could be treated this way. We still believe some would need a teledermatological consultation. It might be that you are asked certain questions about your life in general, whether it runs in your family or whatever it could be, to get closer to the right diagnosis. Lastly, we still believe that 10% of people still would need to go see a doctor face-to-face because there might be other comorbidities that there is to be treated. As you see, we have much shorter loops here because technologies are creating this mechanism of diagnosing and prescribing treatment, and then again following up. Most people with a skin condition, or some people with skin condition, would have a lifelong disease, which means that once you are diagnosed, you will get into this maintenance phase of following up on your treatment. So it will appear and disappear, and here you would stay in control yourself with your disease. So that is why we need some digital solutions to help that follow-up process work even better. In Leo Innovation Lab, we have now 10 companies that are impacting this patient journey with different tools and features to ensure that people are being treated better and faster. Half of these companies have been spun out of the incubation lab we have here in Copenhagen, and the other 5 are external investments where we have seen a great potential around the world. So when we plug in our companies, we are really trying to impact the patient journey for the better in the future. And then I would like to show a video to you. It might be that the sound is not coming through, and then I will just mute the sound and speak over it if that's okay, but let me know if it works. Is the sound okay? Okay. So, do you hear what I say now? 1 in 3 have a skin condition, and sometimes it can be really difficult to see what it is. Not all of us have access. And when we find out what we have, we really want to know it better. So we have developed Imagine, which is a tool where you can actually diagnose the skin issues just as well as the doctor can do it, with accuracy rate over 90%. When you have this app, you can also follow the treatment and see how your skin is progressing, and that way you can stay in control of your disease, no matter location and income. So with this tool, we have the first project that really impact both diagnosis but also follow-up treatment, to be able to stay in control of your disease, get certainty of what you can do yourself, and really have a better life with a skin condition. So that was my slides for now, and I look forward to the panel discussion.
So thank you, Anne. It was fascinating, and thank you for giving us the Danish perspective and unique Leo Innovation Lab perspective. And now we move to the Israeli perspective by Dr. Daniela Cohen from Maccabi Health Services. And she will talk about the impact of COVID-19 on the future of healthcare. So Daniela, go ahead.
Hi, everyone. I'm just going to share my screen. So sorry, just a sec. There we go. Okay. Having me. I'm very excited to review the impact of COVID-19, what it had on the Israeli healthcare system, and really how we view it in the future. So we'll dive right in, and sorry if I'm going to whiz straight through as we don't have a lot of time. I'll just start with a couple of words regarding the Israeli healthcare system in general to orientate you. So the Ministry of Health is the regulatory body, and we have health funds and hospitals. There are 4 health funds in Israel, Maccabi being the second largest with 27% of the population being Maccabi. That's about 2.3 million people. Everybody is covered under the national health insurance. So everybody gets a very, very broad and wide basic healthcare basket, and they can also get supplemental services. Is a group, and we have many, many companies that work as part of the Maccabi group, dental clinics, pharmacies, etc. Just going to say a couple more words about Maccabi Tech, which actually runs database research and clinical trials and works with biotech companies and pharmaceutical companies in order to do that research. And also Maccabi has an innovation arm which progresses and is actually an incubator for early stage technologies. So really, COVID in Israel. Our first case was on the 27th of February, and that really started the beginning of, I would say, the first wave, which peaked around April, and we had a second wave, July, just going on and on till September. And throughout both periods of time, we had generalized lockdowns. And till today, over 300,000 people in Israel have been diagnosed and treated for COVID. So the challenges, and there were so many challenges, and we're still going through challenges, and everything really stemmed, I feel, from the rapidly changing situation. We didn't know what was going on, we didn't know anything about the virus, and we had to really think on our feet and very quickly to make all these changes. And Maccabi, being a large organization, had long-term plans. We have a lengthy process for change, even though relatively I think we are quite agile, but still this was beyond what we were used to. We had to adapt and change very quickly. Beginning with COVID-19 testing, I mean, no one really knew what kind of tests we needed, how often to do the testing. We had problems with getting all the test kits to it. So that was a whole big issue. PPE, again, what's the best PPE to be used? How do we get it to Israel, to our providers. How do we get enough of it? There was always a shortage. So that was another issue. Continued delivery of healthcare. This is actually something we're grappling with still, because people did not want to come to clinics. People did not want to go to hospitals. And COVID is not the only medical. There are some heartbreaking stories of people that have died at homes because they did not want to go for their chest pain into hospital. And this is something that's really in the forefront of what we're trying to do. Communication is a big issue. Still, just getting all the new guidelines and all the new information, patients, but also to our healthcare providers, everything rapidly. But if the people on the ground and in the field and treating patients don't know, then don't do the problem. The Ministry of Health, communication with them as well was quite challenging, and that was a whole issue in itself. And I put fatigue down here because I think we've all been feeling, after months of dealing with COVID, not only physical, but also some mental fatigue with everything that COVID's brought to society in general. So really, what are our solutions? So I put down a list of a few things here, and we're going to go through each of these separately. And this is just a broad base of what of the subjects that we've kind of brought forward as solutions. So the big one is telehealth. Obviously, COVID has really brought all of this to the forefront. And telephone and video consultations have now become mainstream in Maccabi, whereas a year ago we did not have that at all. We started working on video consultations, but COVID brought the whole programs forward immensely, and we even had to change the provider that we were thinking of working with because we saw that it wasn't really what we needed in the field. So also again here, very, very quick changes that we made. There's a picture attachment available to the EMR, which is something that's very helpful. KMD is an app that Maccabi developed together with K-Health, and in it, patients can just ask certain questions, and there's an AI-driven program that provides solutions, answers to their medical queries based on all the information that Maccabi has built over many, many years of having electronic medical records, and the way the patients what happened with the patient's problems, but also how physicians actually reacted to the patient's problems. And that's the first tier. But the second tier is that you have access to a chat with a physician. So patients having gone through the KMD app, they can also actually chat with a physician himself. We've implemented a COVID triage in the EMR so that patients that have symptoms of COVID will not come to clinic. We'll actually divert them to perhaps a telephone video consultation. We are working on virtual post-COVID clinic. Post-COVID we have recognized this being a real issue with patients and physicians not really knowing what to do with these patients. So hopefully this will come into play next month already. COVID Curve is a telephone line by just disease specialists. Doctors can call if they have queries regarding their patients, but not only their patients, regarding themselves and their families as well. Because being on the front line, they had a lot of concerns, and we thought this is very important to address also. Remote diagnostics, again, a really big thing. And I just have here on the slide one possibility that we're looking into, which is called My Home Doc, which it can pick up a lot of the vital signs, but also listen to heart and lung sounds. Training and education with all this telemedicine, we never learned in medical school and how to do a consultation through telemedicine. And it's been very, very important for the confidence of the physicians and the patients to train our medical personnel to do this properly as best we can through telemedicine. And we also have a Telederm app, a little bit different from what was described. So basically a patient takes a picture, sends it, and a dermatologist gives an analysis and can already give treatment, including prescriptions through that. So whizzing on, automation. Maccabi's usually deals with tens of thousands of tests per day. We had to really increase capacity, especially for COVID tests, and we upgraded the whole system. It's very, very automated, computerized, and from end to end today, within 24 hours, a patient can get their COVID results. Repurposing. Yes, repurposing. So have so many apps and so many devices. What we added to there's a mobile physician app, for example, and we added a lot of information specific for COVID and all kinds of processes that the physician can do through the app specifically for COVID. Innovation, lots and lots of innovation. I just brought one example, which really has caught the imagination of a lot of people and was even on CNN. This actually came from a physician in the field. I spoke about the problems with the PPE, with the testing. So this is a little booth where you can see that the tester is in the booth. He doesn't have whole PPE, he doesn't need it. And it's very convenient for both the tester and for the patient. And these are portable as well. They're very durable, and they were a real hit in the field. It was very, very useful. Flexibility. Okay, so Maccabi Red is actually a service we provide that we provided before COVID, which works on the system of Uber. So, for example, if a patient comes to me in clinic, they have what I suspect is a foreign body in there, I can send them to the ER, or better for the patient, I think, and just in general, I can use Maccabi Red. I put into the computer the details of the case, and whichever ophthalmologist in the field is available at that point can just pick up that case, sends me the details, sends the patient the details directly. They get it on an SMS, and the patient goes to the clinic, and the ophthalmologist would take care of it actually in the community. So this saves an ER visit. And we've really pushed this whole program forward during COVID because people, as I said, do not want to go into the ER. And the more we can avoid that, the better for our patients. Also coronavirus community care. So the Ministry of Health stipulated that every single patient having COVID needs to have a proper intake, monitoring, and discharge. But most patients were actually in the community and not in hospitals. So we had to very, very quickly set up this whole infrastructure to deal with these patients and monitor them correctly. So patients got a corona monitoring set home, and either home or hotels, because some of the patients were kept in hotels. They had to fill in a digital symptom form every day, which we got the information from and was also put into their medical records. And so we built this whole huge infrastructure and actually managed, I think, very efficiently and giving really exceptional care. We managed to treat tens of thousands of people through the system. Adaptability. So really IT adaptations, hundreds of adaptations. And this necessitated a change in our work process. As I said before, everything changed very, very quickly, even within one day. So we had to have very, very short cycles for IT developments. What used to take months before now had to be done really on the fly very quickly. And they've continued working in shorter cycles. We found that to be really the most efficient way to work. Just to give some examples, we had multiple EMR adaptations. For example, we had to build a COVID registry, a smart testing referral, which really changed every week with more and more indications and changing indications, and that had to be adapted. We also have a smart COVID intake document, which you can see all in Hebrew, I know, but just for you to get an idea, which really helps the primary care physician in putting in all the information they need when doing an intake for a patient. And not only that, but because there are so many changes, if they're not up to date completely on all the changes, then we put it into the referral form, and this really helps the physician do the best job possible. One more adaptation I'll just mention very briefly is our new digital platform that we built, which sits on top of the EMR. And this enables us, for example, to record vaccinations that are actually carried out in parking lots or anywhere else in the field that are not done in clinic in front of the EMR. And this enabled us, for example, now in the flu vaccine, in what we're doing with flu vaccine programs, to actually give the vaccinations in many other places and not in clinics, because once again, we do not want people to come to clinics. And so this was really very revolutionary, because the nurse can actually, using her mobile phone, enter into the EMR that the patient has received the vaccination. Where's the future hold? What's our focus going to be? Obviously, we're going to continue with telemedicine. That's at the forefront, and we're going to just develop that and bring in new ideas and new innovations. Digital triage, we're really working on expanding that and making sure that, because of all the options that there is, that it fits the patient's problem, fits what he or she chooses as a consultation mode, if it's telephone or video, as we see that not always is this really matching. Rapid testing is going to change the way COVID is dealt with within the community, and that's very, very important, and we're working on that. Home hospitalization, we truly believe anyway that really as much care as possible done in the community is better for the patient and their families. But we're expanding home hospitalization, which we started 2 years ago, and hoping to get to 100 hospital beds very, very shortly. And that will also bring in a lot of innovations and technological innovations. And everything to do with AI and machine learning, I really think that that's going to really take over and be very, very dominant in how we're going to see development, and really help us focus on the things that we need to develop. So having said all that, I really have to finish with a note on keeping it human, because I've talked about a lot of technologies and developments, innovations, but at the end of the day, I really think that we need to remember that all of this is done to support the care that we give our patients, to support helping them. And I actually truly believe that at the end of the day, the human touch is what helps the most. So thank you very much for your attention. Thank you.
Thank you, Daniela. It was fascinating, and it really seems you've done a lot in this short period of time. And now for our last speaker, and then we'll dive into the panel discussion, and we'll have also Professor Afibiar joining us. But first, the perspective from Turkey. So İlkis Koza from the Istanbul Medipol University. You can go ahead.
Yeah, thank you. Let's share first. Yes, first of all, I do believe that we will learn a lot from each other's experience against COVID-19 studies. I think we have different healthcare service infrastructures and payment. That's why it is the best way to describe what we had before COVID-19 in order to understand what we can do against COVID-19. That's why it's brief information about Turkey. We are a unitary state. That's why I think it can make me more robust to the federal country. Population to maintain care service. The social security system covers all citizens in Turkey. Besides, the private sector is also influential in both healthcare and insurance system. The application that I'd like to share is ePulse, in Turkish e-nabız. I'm glad to say that Turkey has a central electronic health record, EHR, called ePulse. Formerly, we were calling at Turkish South system has been since 2009. It is integrated with both public and private healthcare providers. The mobile to access their electronic health record was published in 2015. It's called as EPAL. This slide. It is electronic patient records. Since this citizen can access their electronic health record, contribute to this report they need. Nowadays, thankfully, the now exceeded 20 million users. The EPAL system became a significant, especially to show the citizens COVID day. Turkey has a robust and safe intranet among all public hospitals. There are 2 data centers and more than 500,000 users on this. And I think one of the crucial achievements in Turkey is this system. We have 6 call centers having more staff in this system. Any citizen using this any of the public hospitals at any time. One of our university will be published so that the system is significant the waiting time within a hospital. Broad medications such as telemedicine, telemedicine world, but COVID-19 showed how crucial telemedicine system could become, especially in such pandemics. Turkey has a central teleradiology system and system vendors. It has an essential role in storing X-ray images when necessary. The most important outcomes of such system for me is the intelligence system showing on all sides. The Turkish Ministry of Health is using a comprehensive analysis called SINA in Turkish, in thousands of indicators. So all those systems enable to make their decisions, I think. And the as we know, COVID has a high transmission communication restriction. Curfew or youth. On the other hand, national or provincial lockdowns are hard to can be harmful to the economy. That's why apply minimal air houses connected to wide area lockdowns. To apply that, we need to person of the COVID-19 positive. To achieve that, Ministry of Health affiliate called PITAS. When a positive lab test result of any person is uploaded to public health, the case is also to and then assigned affiliation team. Before visiting, the citizen get SMS message meaning that the affiliation team will have the contacted person. The affiliation team finds the contacted person and visit.
Yeah, sir, just for sorry, is it possible for you to maybe to shut down your video so you can hear you better, because the connection is a bit disrupted? It might help. Just to turn the video off. Okay, let's try this one.
Yes.
Yes, much
I
better.
said, thank you for the creation team determines person and visit each of the, as I said, and regarding the evaluation of filiation team with the contacted person, order suspected citizens. If like filiation team requests the contacted person isolated for 14 days. In Turkey, we have family physicians has a physician, so those family physicians are positive or suspected cases during the lockdown isolation period, which is nearly 100%. On the other hand, I'm afraid Turkish citizens are not good enough to follow rules, and this is unfortunately raising the outcome studies. The last the life is or something like that we call is as HAS in Turkish in short. This mobile application two essential functions. First, it enables the students in most areas. Code is for training. As a result, we can say that the COVID-19 experience is a kind of stress test, so that the local healthcare capacity of most countries was not ready for such a challenge. It's quicker, integrated, and sufficient. Since the logistic is corrupted, globalization has failed for hardware. On the other hand, we can say software solutions used in such as telemedicine, monitoring, etc., became more popular. I thank you all for listening to me, and I hope this presentation will for the audience. Any questions we will welcome, and thank you.
Thank you, Ilker, very much. Very interesting to see the other side, what Turkey is doing regarding handling COVID-19. Really, really interesting. So we have a few, I guess, roughly 20 minutes for a quick panel. And before I invite Professor Rafi Biar for the panel and discuss present himself and also answering interesting questions. I just wanted to actually start with the first question and as I promised you, to present what we do and what is also relevant to COVID-19. So actually the first question was, what is the most significant transformation that the panel have seen happening during COVID-19 crisis? And we're not just talking about, the obvious things that things might have been working rapidly on some certain areas, but we really wanted to hear from you what is the good stuff, what really happened, what is the interesting things you saw during COVID-19. And before that, I would like to answer this as well. So as I said, Health IL is a national program for supporting digital transformation in healthcare. Mostly in Israel, but of course as well globally. So on that, what we actually doing is we work as an innovation ecosystem in healthcare. We work closely with the health organizations in Israel, but also with the startups and technologies, and we help them collaborate and actually accelerate the pace of digital transformation by promoting pilots and collaborations in the ecosystem. And this actually allows us to see a wider perspective of the changes that happened in health organizations and in general during the crisis. So just to share actually two quick slides of what we saw during COVID-19 crisis. So this is basically a graph that comprised, but based on the changes in Israel during COVID-19. So you can see the number of active cases, as Daniela showed, and we can see that we actually divided to the crisis management period, which is the first part where most health organizations and everyone actually got ready for handling COVID-19 for the first time. But then we divided to dynamic routine management, which is also regarding the different waves that we see and we will see. But after the crisis management time, we can really hopefully manage it much better. So what is interesting that we saw that even though we work closely with multiple health organizations and innovation leaders from health organizations, their attention to innovation has dropped dramatically at the beginning of the period, like the crisis. It was because they really had to handle with much more crises within the health organization. But they actually, in implementing and maybe trying things that are deployable, that's relevant for them, and a certain amount of time there, they were very active on that. It was also very interesting as after the first period ended and we got into the dynamic routine management period, we saw that there were more than ever more willingly to collaborate with technologies and to implement technologies. But the other side is actually to look at the supply and demand curve. So the yellow line is actually represents the number of applications for collaboration from startups and tech companies that really want to help health organizations to promote innovation. And at the beginning, we saw multiple applications per day and really trying to help the health organizations. But at that time, they weren't really accepted for different technologies. But now, when they are very highly accepted of technologies, we see a decrease in the applications for collaboration. So it's maybe the time to encourage every startup and tech company that has relevant solutions for COVID-19 or in general on remote and telemedicine to really jump in and help with this great venture. I think the last thing I wanted to show you, and I think that Daniela already talked about it a bit, is the difference between the first period in the challenges. We see a dynamic challenges map on what the health organizations are seeing. If they were focused on logistics and operation, and of course tests and all these things. Now in this dynamic routine management time, it's more about looking at populations at risk, community health services, and actually routine management within the hospitals and the community care. So we see that health organizations are more than ever accepted for innovation, and we really call for all different technologies to come and collaborate. So on that note, I wanted to ask and actually, first of all, present Professor Wafi Bial, and actually to ask you to present yourself because you have many different hats, and also maybe try to answer this question. What was the most significant change that you saw during this crisis?
Okay, thank you, Yael, and thank you all for this great webinar, international, looking at other parts of the world. I myself I'm appearing here on behalf of the Alive Israeli Health Fund, which focuses on digital health as well as medical devices. And this is done in collaboration with Maccabi, Asuta, and other investment partners. Myself, I'm a professor of medicine and biomedical engineering. I'm a practicing cardiologist, and I was also running a Rambam Medical Center until a year ago and was dean of the Faculty of Medicine. So I know all the aspects of medical care and innovation. I think that what is very the most drastic feature in this COVID is acceleration. First of all, it hits all the different frontiers, whether you talk about public health, those that are not yet sick, including the economy part of that. It affects tremendously outpatient care, inpatient hospital care, including intensive care units, and obviously it also have a huge impact on innovation in terms of both stimulation for new innovations, needs for many innovations in digital health, how to manage our patients, and also taking the innovation of digital health to other spheres. And I think which is regulatory pathway, which has been markedly accelerated, whether it's in Israel, FDA, anywhere in the world. So I think that this is the most robust thing that I've seen. And it doesn't matter. We do that in outpatient clinic where we need to do digital health to treat our patients without seeing them, but without actually contacting them. This is a major thing. Things has really, changed from a few percentage before that to almost 60-70% of outpatient visits, whether it's a hospital or an outpatient clinic. So this is one. Within a hospital, we had to manage and how to really treat COVID patients. When you have a large department, how do you really control that? This has become a major challenge in itself. So control has become very important. This is in addition to accelerations in immunization, therapeutics, understanding the mechanism of infection, and all these things. So I think the common to all of this is acceleration. The world during 1 year happened in medicine what did not happen for a few decades, I can tell you, of innovation. And technology had a lot to do with that, and innovations has a lot to do with that. So I think this is the most important thing that I would, if you want to summarize into one major thing that happened, is acceleration in all frontiers, including also data management, ability to map things, combining of data, sharing of data. All of this is under, and I think that we're still at the beginning of this process.
Great. I also definitely agree. So you basically said that you were like a former hospital manager, you are an entrepreneur, and now you're also an investor. And I also know that the Life Fund was, gathered and funded before COVID-19 times, but were, only started to work during COVID-19. So I know that there are a lot of changes in business models for startups. We see it changes and for good and for bad, but did it change your perspective as an investor, and also with all the different hats you have? And first to see a perspective of the change in business models for startups and technologies, but also what are you looking for something different these days, given all the changes that happen?
Well, first of all, I think that we saw a major acceleration in digital health solutions, whether it's data, whether it's artificial intelligence, whether it's all remote care systems. So we're seeing a lot of companies. Some companies dealt with that before that and changed it to COVID. But what is very important is to, first of all, as an investor looking at companies, is to look at the long term. Of an idea in a company, not only how will it do in the next year of the pandemic, how does it deal with a new world that will continue for years after that. So that's a very thing. The other thing which is really very obviously funding is more difficult these days because of the economy. So I think this also is a change. We're seeing a lot of technologies, both in digital, both in acute care. We've already made investments in medical devices, and we're looking into digital solutions for taking care of patients at home, and managing drug therapeutics, increasing adherence. So there are many things that we do that are adapting to this new world that is seeing. But we have to remember that medicine, despite all of that, despite all this acceleration, medicine moves slowly, and safety is the highest thing which is needed to be kept. And that's something that we also look into the long-term effect of what we are investing in.
Okay, so you're saying basically to look at startups that they have a long-term vision, not only focused on this specific crisis, but really still looking long-term, but then still you see more evidence that we saw before COVID-19. Actually, my next question is for Ilker and Daniela. You both presented a lot of things that you've done in your organizations during this crisis. And I think I wanted to ask you the thing that interesting, at least me the most, is that we saw a lot of advances in digitally and especially in remote healthcare. But what do you actually plan to do in your organization in order to maintain this progress, to make sure that all of the different physicians and medical teams and health teams actually boosted and advanced towards being more digital? But will it come back in the minute that they will have good vaccines and things will calm down? So what will you actually do now in order to maintain it and make it stay even further than just the COVID-19 crisis?
Well,
so,
oh, sorry. Well, I think I've actually alluded to some of the things in the presentation, but I think that's really a very good point that you're making, because there are so many advances and everything accelerated so quickly that we really need to think where we want to go forward and with what we want to go forward, because there's so much out there as well. So we really need to pick and choose very wisely. I would say that in the organization, we're really focusing on trying to match what the digital platform that a patient uses with the medical condition. So as I said, digital triage, we're really trying to look at how to do that as best we can. I also think most of the technology we need to if we look at it, it should be really needs driven. And what I mean by that is that we need to listen to our practitioners in the field and really see what they need and what are the needs, rather than just the ideas of the technology for the sake of technology, but what we can actually practically use in the field. So just to give one example, many patients didn't really want to go into, as I said, didn't want to go into the hospitals and into the clinics, and for example, didn't want to have x-rays done. So we're now moving into using point of care ultrasound, and we've expanded that quite a lot. And many more clinicians now are learning how to use that. And hopefully they're going to be able to use that in the community clinics to diagnose a whole series of things rather than send them to hospital. So that's one thing that we're really developing is focusing on technologies that we can use in the field, and the training. As I said again before, we have to teach our clinicians how to consult using all these telehealth modalities, and it's a new way of thinking, and we need to focus on that as well.
Yeah, I completely agree. The focus on the actual organization, how to implement it, and look at the end customer. It could be the physician or anyone else, but really to have it implemented and adjusted to their needs. Ilker, can you hear us? Do you have anything?
I'm stopping sharing my
video.
Yeah.
Yeah.
Actually,
Perfect.
Using artificial intelligence will become more widespread in our country. All cases in healthcare fields in more. I think I heard that Minister of Health is about application here, and I guess remotely. Could you hear me clearly?
So I'm not sure if I'm the only one that can't hear you, Ilka. Okay, I guess the connection is a bit off, but we'll make sure your answer is heard anyway at the end. If you can write it, it will be also very helpful. The next question is actually for Anne. So we saw a lot of advancement. You showed us, and we see it all over the place, so it's really out there. But I guess there are still a lot of barriers, and I think that, Anne, from your unique perspective, that you can really see all the different technologies within or without. What do you think really are the barriers, and where we should put our efforts, maybe in your country, but actually worldwide, to really overcome these barriers?
Yes, thanks for that question. So during the COVID, we have had some solutions out, for example, to track skin conditions through a clinical trial, because we don't want patients to show up at the hospitals while attending a clinical trial. So here we saw actually that we had the solutions on the shelf. It was easy to implement, but the infrastructure in the hospitals and the systems could be a challenge to integrate into. So there is definitely something around having access to the right software systems as a solution provider, to have those access, but also regulatory-wise, really to allow to have consultations in a different way. So I think some of the barriers we was to have better test setups, to have the solutions tested in a not too regulated space, and to see how it works before we put regulations on it, if that makes sense. And that varies across the globe. Some countries are very open, others too open, but that could definitely be a place to look into how we test very, very early in our development of digital solutions.
Yeah, okay. Great, yeah, definitely makes sense. So we actually have room for one last very quick question for all panelists. Hopefully we can hear Ilka, but if not, just we can ask him to text for the audience. So if you can think of one key element for future perspective that can really drive or maintain the drive of this transformation, specifically in your country, or you think it will be impact globally? It could be actually a technology or a technology type. It could be a process. It could be anything else. But just in like one sentence, I would like everyone of you just to say what is for you the key element to maintain and support the digital transformation further on. So Anne, you're already on the screen.
Yes, so I mean, in many places of the world, we have a transaction-based healthcare system. So that means that every time the doctor do something, they get paid a specific amount. But if moving that towards more an outcome-based system, where you get paid if you have success as a doctor, then I think you would be much more driven towards doing it optimally and really continue with the solution until you have the specific and the right treatment to their patients. So looking into the healthcare systems on how we are putting value on care would be my first one.
Rafi?
Well, I would do the connectivity between the inpatient treatment of patients and the outpatient, between the hospitals and the health systems it should be actually seamless and transparent to all instantaneously, and share data and be able to use the data also for larger scale studies.
Yeah, that's great. Elker, can you hear us? Or
I can hear you. Can you hear me?
yeah, yes.
Perfect. The key solution will be with all health providers, and such systems application artificial intelligence and the key
Okay. And finally, Daniela.
So actually, I agree with what everybody said, and maybe I just add two more things. Is agility. I think that's really important that we have that built in our systems to be very agile and flexible and able to change quickly. And I think also regulations. Regulations we need to try and on a national level, maybe it really needs to be more agile in itself, and it needs to be able to change and be much more in tune with what's happening really in the community and in the field, and not just be separate, because that's the feeling often.
I also agree. I might add, and I agree with all of you, these are really important key elements. I will also add that partnership and knowledge sharing, I think first of all knowledge sharing, but then to collaborate and actually work together is one of the main keys to maintain and promote transformation for the future. So thank you for all the amazing speakers and panelists. And I think we're almost done. Just handing over to Louise to conclude and end the session. Louise?
Louise, we can't hear you.
Can you now? Do you hear me now?
Yes.
Yes? Okay. So sorry. Yeah, I just wanted to thank you also, all of you. I think it's been really fascinating and eye-opening within 1 hour to get the perspective of 3 different countries. So I am a Senior Innovation Officer of the Innovation Center of Denmark in Tel Aviv. Denmark has 8 innovation centers around the world in what we consider innovation hotspots that Denmark can benefit from in terms of different types of collaboration and strategic partnerships. And so what we do is we facilitate these collaborations for researchers, companies, startups, public institutions, and help with any type of collaboration that could be beneficial for Denmark and Israel. So I also just want to invite anyone listening today that you're welcome to reach out to us if you'd like to explore more collaborations with Denmark or with Israel. And with that, I will turn it over to my colleague Denise, who will close this webinar of today.
Thank you, Louisa. Can everyone hear me? Hello?
Yes, we hear you.
Thank you very much. I'd like to thank everyone for participating to this very interesting webinar. We've heard the perspective of how healthcare systems in each of these 3 countries have reacted to the COVID-19 situation and how it triggered them to innovate in various ways. I would like to extend our invitation for yet another webinar coming up next week, same time, next Wednesday, where we will have another example of cooperation between Turkey and Denmark and Israel on healthcare and innovation, this time from the perspective of companies, some of the most largest Danish companies, along with some startups, to hear more about how COVID-19 triggered them to innovate within themselves and how that affected the way of doing business in a new and innovative way. I would also like to introduce myself. Last but not least, I am Danish Senior Trade Manager sitting in Istanbul, assisting Danish companies who'd like to collaborate with Turkey and the 7 neighboring countries in our region. So for all of those who'd like to reach out to learn more about what we can do together, please feel free to contact us. You have all our contact details on our social media and our website. And thank you very much for being a part of this very interesting event. See you again.
Thank you.